is an issue that's pretty dear to your heart based on that there. We haven't heard as much the last couple of years about healthcare. Maybe it's moved off the radar screen for a lot of people. Do you think that's because the system is flowing well, or has it just been overshadowed by other issues? And do you think there needs to be more talk about the debate right now?
Well, I think that certainly from a patient's perspective, when somebody is sick, they don't have time to be advocating for modernizing our healthcare system and making sure that people have better access to quality care when they fall ill. You're worried about getting care and getting better and enduring the suffering that you have and getting out of that, moving on with your life. So the patient has a difficult time doing that. Policymakers and political parties and governments, regardless of stripe, are really, I think, afraid of tackling it because we've so wrapped up our sense of identity with the Canada Health Act and healthcare that to be seen to modernizing it is falsely seen to be somehow doing something bad, when in effect if you go into emergency departments and see the waiting lines of 4, 5, 6 or more hours, that's not good care. Waiting 6 months to a year or more for care is not good care. There are so many people, and I've obviously seen this as a physician, who live lives of quiet pain because they can't get access to the quality care that they could have. So that, I think, has been a challenge for us, but it's something that we have to grapple with, and I'll give you an example. President Obama's budget officer was being interviewed, and he said, regardless of all the other economic challenges we have, the gorilla at the dinner table is healthcare. If we don't get our costs under control, it's going to destroy our budget. And in fact, what we're seeing in our country is that costs rise at 6 to 8% per year. Because demand is rising because our population is aging and technologies are becoming more expensive, and revenues increase by 2% a year. So that difference between a demand of 6 to 8% increase per year and a growth rate in money of 2% is just going to continue, and what you see is a widening gap between supply of money and demand for those resources. So that's the challenge. We have an aging population, more expensive technologies, and no matter what we want to wish away, that is the gorilla at the dinner table. That is the wall that we are careening towards. So in Europe, they've done some smart things. They had similar problems to ours, and they've adopted various tools and techniques to be able to modernize their system. So if you look at the world experience and ask yourself the question, well, who has the best systems in the world in terms of outcome, performance, population health, patient satisfaction? And what you see is that 17 of the 20 healthcare systems in the world are actually European. And so I think what we need to do as Canadians is ask ourselves, what are they doing right in Europe? And can we take things from them? Our country, Canada, performs 26th in the world, and yet we have the 5th highest rate of expenditure on a per capita basis. So if we're paying the 5th highest in the world and our performance is 26th, Europe is paying less and their outcomes are better. Why don't we take a look at Europe and see how we can maybe adapt and adopt some of those solutions for us?
Well, are there anything in specific you think would be good to bring in here to modernize the system, or any ideas you've been advocating for on that issue?
Well, there's a lot, but I think the interesting thing is that from a federal perspective,
obviously you can't do everything,
Sure, but the management of healthcare is a provincial responsibility. The feds give money, and they also are the ones that enforce the Canada Health Act. And I think what we need to do, one of the things we can do, is we can sit down and we can work with our provincial counterparts. The feds should sit down at the table with the provinces and say, look, we have a common interest, we have a common problem. How do we enable our citizens of our country to be able to get access to quality care when they fall ill? And I think that's what we've got to do. And if we pull out, we don't need to study this anymore. There are mountains of studies. We just need to start taking those, using them as pilot projects, adopting them, and the feds need to give the provinces the tools to be able to ensure, this is the bottom line, that every single Canadian in our country, regardless of the amount of money they have in their pocket, has quality access to care in in a timely fashion in their time of need. The Europeans, for example, to answer your question, they look at the patient as being a source of revenue. In our country, the patient is seen as a drain, so systems don't want patients in effect because they'll actually take money away from them. In Europe, what they do is that they give hospitals, for example, block funding. So they give them some of the money is called block funding. They receive some money, but they also can generate money from the patient. Money flows from the patient. You treat a patient, the hospital gets paid for that. In our system, hospitals receive block funding. They receive a chunk of cash, and what they have to do is they have to treat all the people that come in through their doors over the course of a year. Now, the fewer patients you treat, the fewer complex patients you treat, the more resources you'll actually have left. The more complex, the sicker patients that you treat, the more those monies are going to be consumed. So what happens is that hospitals start running out of money. And what they do is they start to withhold care. They start to say, if you're an orthopedic surgeon, they'll say, well, doc, last year you could do 18 total knee replacements, but we're running out of money right now, so this year you can only do 12. That doesn't help your patients. Your patient load will increase, your wait lists will increase, the time for your patients to access what they need increases, and the patient, most importantly, loses. And I don't think that's what Canadians see as a healthcare system that's going to provide the quality care that we should have for our citizens.